Hi, everybody. Welcome. See a couple people filtering in here, so we'll give it a few more minutes. Thanks for joining us. Starting to filter in. You can see I'm at the Battery tonight, which I'm really glad to be here. If you haven't had a chance to come back and see us, we've really encouraged that. My name is Colleen. I'm on the member events and the programming team here. And it's been my pleasure to work on all of our virtual programming as well as our in-person programming that we're starting to do more at the Battery. So tonight, I'm really thrilled to introduce our panelists for the panel Mental Health in a New Paradigm, the Psyche and COVID-19. I worked with Leslie Carr, who is a member, and to put this together, but I'll just introduce her along with our other panelists before passing it on to Leslie. Leslie's a clinical psychologist who's worked in a variety of environments over the years, including inpatient psychiatric hospitals and community mental health settings. Dr. Carr is on the Advisory Council for Bring Change to Mind, a foundation devoted to changing the way people think about mental health, and she's the host of an e-course on how to use technology mindfully. And she's joined with Bart McGee, who's also a licensed clinical psychologist practicing in San Francisco. He's the principal founder of Access Institute for Psychological Services and has been the executive director since its inception in 2002. Also joining us tonight is Luis Perez. He is a licensed clinical psychologist who has experience in a number of clinical settings, including inpatient and outpatient facilities, family centers, schools, and community agencies. Born in Cuba and educated in Mexico and the US, his international background has helped shape his interest in multicultural theory and diversity studies. And last but not least, Blythe Adamson is an epidemiologist and economist specializing in infectious diseases to accelerate the development of valuable treatments, vaccines, and public health policy. I am so thrilled to welcome this amazing panel of people to speak on this topic. We are in webinar format, so we will do a Q&A. So please put your questions in the Q&A chat down at the bottom, and we'll get to those towards the end. And so now I'll pass it over to you, Leslie.
Thank you so much, Colleen, and thank you to my fellow panelists for joining me this evening and to all of you out there who are listening. I want to say just a couple words before I bring my fellow panelists in on the conversation. You know, it kind of goes without saying that these are challenging times that we're living through. If you are in Northern California, which is most of us right now, we have been living through fires and smoky air. I'm seeing a patch of blue skies for the first time in over a week. All of this is happening amidst, kind of on top of, a global pandemic that is raging pretty much unchecked in the United States. So it goes without saying that none of us is having a particularly great time right now, but in my mind, that also makes it a great time to have a collective conversation about our mental health. So one last thing that I'll add is that I think that this pandemic is revealing certain underlying truths about what it means to be human, things that psychologists know very well that the general public is not necessarily as aware of. A lot of that gets into things like how incredibly wired we are for social connection as human beings. We're a very social species. We don't do particularly well with isolation or being alone. We also don't do particularly well with a kind of a chronic assault of stress hormones building up over time. So, you know, without any further delay, I'm going to pose my first question to you, Bart. In the lead up to this panel discussion, one of the things that you said to me was that you don't think the local government in San Francisco has done a particularly good job of crafting the messaging around this pandemic in a way that was either mental health informed or took human psychology into account. And I wonder if you can kick us off here by letting everyone know a little bit about what made you say that.
Well, thanks, Leslie. Yeah, as you know, we've had many conversations about this, and you know, as you said, since the very beginning, I've been thinking about the mental health consequences of this pandemic, and I was really hoping that we could use it as an opportunity to effectively use psychology to combat the spread of the virus, and that we might use some of those lessons that we learned from the AIDS epidemic, not only to use psychology to combat the virus, but also to provide social support so the effects of the pandemic wouldn't be so great. And we might be able to talk about that a little bit later, but Yeah, I mean, in terms of where I think we've gone off, I mean, let's just start with the fact that, that the virus spreads through human behavior, and behavior is guided by psychology. So individual and social psychology. So it seems like a public health approach that's guided by psychology would not only be the most effective at stopping the spread, but also would be, able to help mitigate some of those negative impacts, which would be like a win-win. But much of the messaging, I feel like, has really been focused mostly on anxiety, and that's where it hasn't really been terribly sophisticated. It's like, and of course the media picks up on this, but most of the messaging has been about be afraid of the infection, stay indoors, avoid all contact with strangers. It's like, and the whole paradigm of shut down and reopening kind of reinforces that. It's like the goal is to get to people to hide inside until it's safe to go outside. And of course, people need to be informed about risks, but it needs to be done in a way that provides support and a sense of self-efficacy. But I don't think that's really been happening. It's like people are stuck in this kind of anxious, helpless state, where your ability to think breaks down. And people aren't being given through those public health messages like reassurance, which includes solid information and helping find ways to stay safe. It's like people need support for ego function. And without that, and in this kind of state of elevated anxiety, people do tend to look for something to rely on. I think that's kind of what's happened, is that people look toward the rules. And then that ends up, and again, I think a lot of the messaging is very rule-based. And so it often comes in the forms of rules, prohibition, and a kind of binary thinking, like right behavior, wrong behavior. So again, without that kind of support for people being able to, have that kind of ego function, which is about, being able to interpret the environment, know what's going on around you, make sound judgments, evaluate risks. Really, it's that thinking function. They've reverted to this kind of rules. And then the rules are not really very helpful because a lot of them lack clear direction. They're sometimes arbitrary, they vary from county to county, and then they problematize things that are actually safer, like outdoor behavior at beaches and parks. And then also, when the rules aren't supported by facts and basic science, they sow confusion, right? And so then again, that just keeps the anxiety going. So what we really need are like the clear, simple guidelines that are backed by evidence and kind of support psychological safety, and that would then support healthy emotional functioning. So I just wanted to give you an example of this, and we talked about this before, but I think for everyone, it's I would challenge you to go to the San Francisco Health Department website and read the guidelines that they've published on face coverings. They go on for more than 10 pages, and I really doubt you'll come out feeling reassured. It's completely Byzantine, riddled with conflicting rules and exceptions to rules. For example, on the one hand, you're required to wear a mask when you're on a busy sidewalk, except when you're seated on that same busy sidewalk at a table eating or drinking. And sometimes it seems like masks are required when you can't maintain 6 feet distance, but sometimes it seems like they're required all the time. So again, it's like really a lot of contradictions, which again doesn't help people feel safe and secure. And also it spreads misinformation, I think, about the risks in the outdoor spaces. And I hope that Dr. Adamson will speak about that a little bit later. And then finally, I think what we really need are these healthy social norms. And again, with all this chaos, we can't develop those norms. And that's where everybody implicitly agrees on what kinds of behaviors we have. And people take their cues from their social environments. So we've got this huge divergence of behaviors. It adds again, and social norms to go along with it. You get this divergence of information. So for example, some people are behaving as if it's not really safe to leave the house, I know someone who won't go in the backyard because it's too dangerous. We also had a crisis at Access Institute this week, and a patient who was suicidal and in risk of self-harm wouldn't go to the hospital because of fear of COVID. So again, and then at the other extreme, some people are going to house parties, right? They're behaving as if you can just go anywhere. And so you've got this vast extreme and everything in the middle. And I think everyone's experienced this, like trying to understand like where your friends and colleagues lie on it so that you can know how to interact with them. It's you got to do a lot of guessing. Yes. So anyway, I guess I'll just leave it there. I just feel like that it's just, there just has been more chaos oftentimes generated by a lot of these rules, and it really just hasn't helped people feel like they can be effective in evaluating risk and staying safe.
Yeah, thank you so much for that. You just said so many things that I want to kind of draw people's attention to, but I think just to get everybody in on this conversation, I'll kind of ping to you for a moment, Blythe. Obviously, there's a lot happening across the country, kind of culturally, in terms of different people in different municipalities, different states behaving differently and that kind of thing. But one of the things that you're saying, Bart, that it makes me think of is the notion of sort of how much is the right amount of fear or anxiety about this. And so it just makes me wonder, Blythe, because I know that you have done a lot of work with healthcare policy. And do you have anything that you want to respond to Bart with in terms of how healthcare policy is generated, or how do you make sense of this as an epidemiologist and an economist? Oh, have we lost audio? I can't hear you. Oh,
she's muted.
Unmute. Can you not unmute yourself? Hold on one second. Okay, bear with us, everybody.
Thank you. Yes.
There we go.
I put myself on mute for my long sighs that were going with everything Bart was saying. I was really I resonated so much. I thought I should mute my deep breaths. Feeling
so
what you were saying. I didn't know that was going to mean that I gave over my control of my voice, not being able to unmute myself.
Well, welcome back. Welcome back.
Thank you. Thank you. I was like, what is the verbal cue for cannot unmute?
Right. No, we gotcha. So yeah, welcome back. Yeah, so obviously he just said a lot. I would love to hear your thoughts on that.
Oh, so much of that resonated because it's such a hard job to communicate effectively public health guidance because there's just so much, there are so many differences in education level, and the messaging has to be, crystal clear and simple because there are many, grown adults who really have the ability to understand maybe 5th grade, 8th grade reading level, and some of the nuances and complexities on one side for very educated people who can process and understand and use that nuanced data. It's wonderful to have that, but a trade-off is what are you giving up in the populations that don't find that complexity as accessible. And so it is one of the hardest challenges, but one of the things that you mentioned, Bart, was, how negative and how many rules there were to follow. And I think that, one of the things that we aren't doing enough is leading people to the things that are good to do and healthy to do in the pandemic. I think of, taking road trips, or going hiking, or, eating outdoors, having picnics, all of these things that are so good for us and healthy ways to spend time with the people that we love. And I think at the beginning of the pandemic, many of the rules that were given were based on uncertainty. When we don't know how this is spread yet. It might be aerosolized, it might be through touch. We had the Purell fiasco of February and March of 2020. And so sometimes the rules were based on the uncertainty. But as we gather more evidence and understand really how the transmission is happening, I think that there's a lot more that we can do to affirm to people what are good and healthy activities. Because the shaming doesn't work. Bart, you mentioned things that we've learned from the HIV epidemic. And, one of the things we learned is that publicly shaming people because of their behaviors and sexual activity is absolutely not the best way to promote healthy behaviors and help health in our population. We show people how to, we guide people in giving them tools so that they can have sex safely and find pleasure and enjoy each other, in a way that is safe. And when you shame, it just makes things go hidden, underground in a way that's not good for any of us. And sometimes I think of masks in the same way. We don't want to shame people for having a barbecue outdoors and taking a mask off to eat a hamburger. If it means that they're going to take that indoors and have a dinner party instead with their friends, it would be better to tolerate and affirm the good practices that we're seeing, instead of shaming people for rigid standards that might actually just lead them to do even riskier things not within public view.
Precisely. Thank you so much for that, Blythe. And I want to ask you one follow-up question before we get Luis in on this. But since there is so much confusion around this right now, can you, and I think you really hit the nail on the head in terms of how the science has evolved, our understanding has evolved. For people that are still, wearing PPE to open their mail or washing their groceries, can you just give us a quick breakdown on risk, transmission, dose and duration, like give people a little bit of a sense of where the risks really are and where they are not?
Great question. So, for a while we had been hearing WHO being aerosolized deniers, and all of the scientists kind of building up the evidence to say, okay, we all agree that this is aerosolized now, right? We don't have as much evidence of there being that environmental surface transmission that we thought at the beginning that was leading to a lot of the Purell and the intense cleaning. I mean, cleaning is always good for hygiene, so I wouldn't say stop cleaning things, but at an individual person level, the risk of transmission from touching your groceries or mail, I think I've seen no cases ever from an exposure like that. The aerosolized transmission, really, if you kind of imagine someone who just during that really short window, a few days before they would show symptoms to a few days after they show symptoms, that high viral load spike time is when even if they don't show any symptoms at all, just their breath is full of virus kind of in a gaseous form. And so you can imagine that, being in a small, tiny conference room with one other person, even when you have a mask on, is the longer that you're there together, the more the potency gets concentrated inside that small room. And so that's why, I feel so much better instead of spending time with someone in a small room, like going for a walk together is a very pandemic friendly activity. Being outside with a breeze blowing, because then you can imagine if you just like sprayed a puff of cologne indoors in a small room versus outside, it kind of just dilutes into that larger space around you.
Yes, brilliant metaphor or analogy. Thank you so much. So I want to shift gears ever so slightly just to get Luis in on this conversation, and then we're going to kind of come full circle here because Blythe, I just can't get over how lucky we are to have an epidemiologist and an economist in one person. It's wonderful. But so Luis, just to get you in on this conversation, even though COVID theoretically does not discriminate, it's affecting people of color disproportionately in the United States. And just to give everybody some numbers for this conversation, in California, Latinos make up 39% of the population, but 57% of coronavirus cases. And in San Francisco specifically, these numbers are fresh off the presses from sf.gov as of today. If we pick a random so-called kind of white neighborhood in San Francisco, pick a random one, let's say Pacific Heights, full disclosure, happens to be the neighborhood I live in, there have been a total of 126 diagnosed cases of COVID since this whole problem started. And in the Mission, where you work, where the population is double, the total number of diagnosed cases is 1,224. So again, 126 diagnosed cases in Pacific Heights and 1,224 in the Mission. Can you just tell us a little bit about what life has been like for you over the course of the past couple months with the community that you serve?
Sure. So I also resonate with everything that all of you have been saying, right? So, and I think that if I can think about a word, I would say amplify that, and that's how life has felt, like working at Instituto and trying to help people during this time. I think that one of the things that, we are a community behavioral health organization, that provides mental health therapy and as well as case management, linkage, education and outreach programs. We have a lot of different programs. We have an outpatient clinic. We have an HIV mental health clinic. We have an early intervention program, where mental health consultants go to school, to work with children and families. So we have a indigenous wellness program as well. And what we have noticed is that what we have struggled with is that, we have been, in fact, just helping these families, get through, these really difficult times. One of the things that when I say amplify is that, the language barrier, right? Like how that information that Blythe is talking about, that has to be simple, straightforward, gets so much more complicated when the information is not available in Spanish, right? A typical population, Spanish population in San Francisco is people, with grade levels, education levels from 1 to 3. Most people that come from rural areas, from Mexico and South America and Central America, and the Mayan population that lives here in San Francisco, also, probably between 1 and 3, but the majority of people have no schooling, and they also speak Mayan. They don't speak English and Spanish. So for that sector of the population, that is mostly concentrated not in the Mission, but in the Tenderloin in San Francisco, we see a lot of, other, difficult things happening with them. So, at Instituto, we have been actually spending time, not too much doing therapy with clients, to address the anxiety, but to help people, basically deal with all these other psychosocial stressors that they're dealing with. Lack of food, lack of jobs, being unable to stay home or do a barbecue, with friends and family because, they have to, the Latino population and the Mayan population, especially the men, they are the ones that are working on the kitchens at the restaurants. They are the Labor Day workers, like trying to get job outside. Meanwhile, the moms are staying home, with the children, trying to figure out, how to, engage them in schooling. So, there is a lot of other dynamics, happening in there. A lot of people have lost jobs, but, a lot of people have actually had to keep their jobs. What has happened with our families is that, so imagine a flat in the Mission with 5 rooms and 5 families live in that flat. In each room you have 3 or 5 families. 3 or 5 people, members of the family. One of the things that we have seen is that at the beginning of the pandemic, people will just like go outside, to play soccer or just to walk around the streets because they actually felt safer without knowing anything that, it was safer to be outside. And then they got a lot of the shaming, right? The city and county of San Francisco also, deploy, people from workers at Institute to actually go with litter bags with Purell and some sandwiches and some masks, like a bunch of indigenous women, from the indigenous program like that together and made this beautiful mask. And we actually went around the Mission, distributing these masks and just talking to people, Why are you outside? Because that's what we know. You're like, you cannot be outside. And then, we already knew why they were outside, right? Because that's the place where they hang out every day. And that's the place where they have to go to get jobs, and because they have to obtain the food outside. So we learned other things. We learned that some of those people, for example, the day laborers, the men, they share shifts. Like one walks out at night while the other sleep in a bed, and the other person just work during the day while the other person shared the same bed during the day. We also learned that a lot of people, are allowed to live in these small rooms, in different houses in the mission, but they're not allowed to use the kitchen. So they're used to obtain, all the food outside, So and then we were having that, from then, we understood, we kind of like moved people around. We understood that people could be outside, that it was actually there for them to be outside. And then we started just like, making little bags of rice and beans, right? Because then people started struggling with food. And we had got some funding, I think we had like $100,000, and we were able to give people 100 families $1,000, for them to pay for rent. Like the things that were happening in San Francisco, keep happening, for the Latino community, so you can imagine also immigrants, undocumented people, really being taken advantage, by landlords. Some people, actually taking them out of their houses, not respecting the laws in the city. So there is a lot of happening that people are struggling with, and we're just trying to help them with as many things as we can. Like we have been seeing people in person at Instituto, providing a space, where we can actually keep social distance, because a lot of the people, that have to apply for housing, like food vouchers and things like that, cannot actually, use a computer. They can barely use a phone, so the resources are very, very scarce. The same thing has been happening with the children, right? Like the moms that were staying home, trying to keep the children at school, couldn't do it because they couldn't help them with their assignments. They don't know English, and some of them don't even know Spanish. So there is a lot of these like psychosocial stresses, as I said, that have been amplified, and we as a group, have been really, and I think that's true for mental health, right? So we think about the Maslow's pyramid of needs, right? We cannot really grow, anywhere to be productive or to self-realization if we don't have the basic needs met, and that's what we have been doing, with a lot of these families. Hence, I think the high number of cases in Latino families, because when one person gets infected, the whole household gets infected, and they cannot go anywhere. They have to stay with each other. Anyway,
So
I don't know.
thank you so much for that, Luis.
Of course.
There are a couple of specific things that you just said that I want to draw everyone's attention to, but I also, now that everyone has been officially welcomed into this conversation and we have put down what I'm going to call a base layer on the conversation I want to have with everybody, I want to ping back to you for a moment, Blythe, and just say, there's so much in what Luis just said in terms of the economic factors and the inequities and kind of how that factors into the policies. And I'm just wondering if you want to share any responses you have to what you just heard.
Absolutely. I've been thinking a lot about this in the context of opening versus closing public schools, because I think
Yes.
that while, on one side, we want to weigh the health of children who we haven't really seen have bad outcomes from the virus, and teachers who are more susceptible to bad outcomes. But really, when schools are closed, it's exactly like you were saying, Luis, of the psychosocial health disparities then become exaggerated for lower income families, for single parents. And from an economic perspective, it's not great for unemployment to have so many people who need to be looking for work right at the time where now they have to have their children at home with them instead of a safe place to go. And so I think you're right that it's just, compounds the anxiety and pressures that often come along with poverty, as now more school and other services are less accessible to people because of the pandemic. It just feels like such a tight squeeze.
Seriously, and it's so interesting. I have a feeling, Bart, you might want to comment on this, but I just think that one of the things that's so interesting is this issue of, for the people that Louise is describing, the fact that they don't have computers, to your point, Blythe, there's this issue of getting kids back to school. One of the things that it makes me think of is how the healthcare policy was written with a certain amount of privilege in mind, because going back to your idea of these Byzantine rules that we were given, if you look at the local San Francisco guidelines, and I'm making a lot of this specific to San Francisco, mostly just because this is where most of us are, even though we are doing this on Zoom, most of this audience is local to San Francisco. If you look at the rules, they are so oriented towards stay home, stay home, stay home, stay home, don't leave the house, don't go outside, be afraid, be very afraid, and let us repeat again, go home. And I just think one of the things that I hear you saying, Louise, that is so complicated is that it's not safer for everybody at home. For some people, it is quite literally, home is actually the least safe place that they can be. And in fact, in some instances, it's actually not even possible for people to be home, because if your version of home is effectively renting a bed where you don't have the right to be in the home for the rest of the day, it just really highlights this, this need to find a way to get kids back to school, because the whole communities can't function.
Yeah, and maybe I could jump in here with my little bit about the, what happened during the AIDS years that I think we didn't learn from, because I think what you're all talking about is that these messages and the interventions have to be culturally appropriate. Like, you can't do a one-size-fits-all message and help communities that have different needs and different experiences. So one of the things that I thought was powerful, I lived through those years in the 80s, and there was a project here. It was actually done by UCSF and community groups. It was called the Empowerment Project. And so it's like what Blythe was saying about how, they knew that gay men were not going to stop having sex. So you couldn't just say, don't have sex, which is kind of what we're trying to say here, right? Just go inside, right? No, so they actually went in and they trained peer volunteers to go into bars and go into the communities and help people learn how to be safe in whatever kinds of sexual activity they're having. So again, you have to tailor it to the community. And the other thing that they did, and that's why it was called empowerment, it was also about empowering people. Like everything Louise was saying, it's about helping people, like showing up with what they really need. And again, tailored to each community, giving them the support they need. And then you give the message, and then you help empower them to, figure out how to be safe in whatever environment. Like, how do you figure out how to be safe when you've got a household where you can't use the kitchen and, several people are in each room and different people are working in different frontline jobs?
Yeah,
that's a real challenge, and we need to figure out how to help people there.
100%, and it's really funny because it actually reminds me of a conversation that you and I had, Blythe, about you brought my attention to a New York Times article about how to safely hug during the pandemic, and I think that one of the things that people really underestimate is the human need for physical contact. When we have welcome contact with another person in the form of a hug or something like that, it releases oxytocin in the brain. Oxytocin in the brain. It's really healthy for the brain. And it kind of reminds me of some of the messaging that you're talking about with the AIDS epidemic and the notion of, you just can't tell people to not have sex. I think one of the problems with the public health messaging is that it doesn't take into account the fact that humans need humans.
Yeah. I just want to say something about that, in also how important it is for Latino, the displays of affection, right? How we greet each other, how we kiss each other when we see each other, it has been, I can say, traumatic, for us to actually arrive to work and have to go like this, because what we do is when we get to work, we kiss each other on the cheek, You know, we always say, you know, why people don't touch each other, why people don't show affection, you know, but what it is that, you know, we do a lot of that, you know, that is so important for us. So imagine also the you know, being deprived or something that is just also such as, you know, cultural value as well, no? So yeah.
I want Blythe to tell us how to safely hug.
Oh.
Can you tell us, please?
Do you
Well,
recall?
Leslie, you've read the article more recently than I have.
Yeah, I'll share what I recall. So, you know, it talked about things like the difference between outdoors and indoors, you know, that especially that if it's, you know, among people who are sort of not in a high risk group, that particularly if you either, you know, if you put a mask on, you can hug face to face outdoors. You just want to kind of get your head around the other person's head so that you're not breathing into the person's head.
Yeah, I think that's exactly right. I've had long embraces with people during the pandemic where you just need like a long, big squeeze. Their face is breathing over my shoulder and I'm breathing over their shoulder and we're outside. And I think that's just, it's so good and important.
Exactly.
You had a few more things.
Yeah, there are a couple of other ones. They were talking about how, you know, grandparents can hug their grandchildren, especially when their grandchildren are small because they're kind of waist height. You know, they had all these little drawings and diagrams. So they were showing, you know, a kind of like a grandparent and a grandchild where the grandchild is kind of at sort of stomach height. They were also talking about hugs from behind, you know, that you could come up behind someone and as long as you turned your head and didn't kind of breathe into their airspace, you could hug them from behind. It was really cute. It had pictorials. But it's very similar, I think, to what you're describing around HIV and AIDS and how people came up with guidelines that were human-centric.
Mm-hmm. Yeah.
So if everyone is game to shift gears for a moment, I thought one of the things that I think is very interesting about what we're going through as a country is that, you know, whether intentionally or not intentionally, and I think we can argue that it's not intentional. Oh, and thank you, by the way. It looks like I see that Colleen put the New York Times article. Yeah, so thank you for that, Colleen. So, you know, when you look out across the world at how different countries have responded to this pandemic, and we see success stories and we see the opposite, and I think it's safe to say that the United States is an example of, you know, not a success story. You know, and Blythe, perhaps you can comment on the issues with, you know, testing, contact tracing, some of the things that have become problematic for us as a country. One of the things that it makes me think of is the notion of herd immunity. I actually read earlier today an article that came out on the 17th of August. What if herd immunity is closer than scientists thought? And I'm wondering, I guess I'll pitch this question to you, Blythe. Do you want to kind of comment a little bit on, if we're going to do this bad of a job managing this problem, is herd immunity our only hope left? Like, how do we move forward from here as a country?
Oh, well, you know, honestly, I think that the way we'll end COVID is the same way we'll end up ending HIV, which is getting a vaccine. And we'll probably end up with a COVID vaccine much sooner than an HIV vaccine. But from the herd immunity perspective, I think we do see the benefits in some small pockets. You know, just the way that I define herd immunity is that when there are enough people in a small, tight-knit group of people who spend a lot of time together, when enough of them are resistant to the virus, either because they've already had it and recovered naturally, or they've been vaccinated, so they have this induced protection from it. Herd immunity is just when there's the spillover benefit to the people who you spend time with, that they're less likely to become infected because of the group that's surrounding them. And so I like to think of herd immunity in a very, you know, micro local setting. There's a family I'm so close with in New York City who they've got 3 kids and one of them, you know, has a vulnerable medical condition. But both of the parents and 2 of the siblings have already had COVID and recovered. And so their child with a vulnerable medical condition is much less likely to ever become infected with COVID because all of the people that she lives with have already been recovered. And so she has this extra benefit that she experiences from her herd. Now, when you think about it in a huge city level, like New York City, there are people coming and going from New York City all the time. And it does make herd immunity more difficult because it's not just a moment. We can measure our seroprevalence at this moment, but a year from now, so many more people who may be naive, never had it, will move into the city and dilute that herd immunity that existed there before. Or people with immunity might move out of the city. But you could imagine, if you think about your office space, if you work with 100 people in your office and 80 out of 100 have been vaccinated and 10 more of them had COVID and recovered, that those last few people in your office space, they're going to benefit from herd immunity from the people that you mix with. So I think it's much more realistic to think about it on the smaller scale than at a national scale when there's just so much migration all around.
Okay, that's very helpful. That's really interesting. Do you want to comment at all on the sort of testing and contact tracing issue in terms of, like, I guess here's what I'm wondering.
I don't know if it'll help anyone's mental health if we
Yeah, perhaps not. Perhaps not. I mean, I think one of the things that I am curious about, I'd actually like to go back to this issue of school, because you said something really interesting, Blythe, in terms of kind of how to make that work. And it reminds me of, going back to this idea of like indoors, outdoors, ventilation. Can you kind of give us anything resembling some optimism about how we could possibly make that work, even if you were to just apply a magic wand to it?
Well, even thinking, I know that too often we keep just talking about the 1918 flu, but one of the biggest game changers in 1918 was when they figured out that in hospitals, if you moved all of the hospital beds to outdoor sleeping porches, that all of a sudden transmission started going down. Right. And in New York City in 1918, they got through it when they realized they could move classrooms to be in outdoor settings. So I think that I do have optimism that it will certainly be easier in places like California and other areas that have temperate weather.
Yes.
The opportunity to restore and revitalize many of the activities by moving them into outdoor places or increasing ventilation, having windows open and fans. There are ways that are, very affordable with the fan opening a window or moving outside that I think can make a lot of our activities more accessible.
Yeah, thank you for that. I'm seeing that some questions are coming in through the chat and the Q&A, and in not too much more time, I want to switch gears for audience questions. But before I do, I want to give everybody, just each of the three of you, a chance to say, like, from a mental health perspective, of all of the things that we're talking about right now, kind of what is most important to you, or what you would want people to take away from this conversation the most? And I'd like to start with you, Louise. Of all of the things that we're talking about, what do you want people to take away from this conversation the most?
Yeah, so I mean, the thing for me is that, culture is so important, right? Having a cultural perspective, what is happening. And if you can help anybody, or you can give an advice, or you can be with somebody that is from a different culture, just ask them what they need. They may not need a hug, they may not need a kiss, but they may need some food, or they may need something different, right? Or permission, to do something that they feel that they can do because they are not from the main culture, and they're gonna experience shame. That different cultures need different things, in moments like this, and one thing don't fit all, right? So one size don't fit all. So that's one thing. I guess it's not about mental health, right?
I think that it is. I would argue that it is a very inclusive approach to mental health, I think. But and what about you, Blythe? What is the thing that you would want people to take away from this conversation the most?
Well, there are some things that we've started doing in the pandemic that I hope that we will keep doing after the pandemic is over. And one of them is telemedicine. The pandemic has made us, we've stopped receiving care for a lot of the other health conditions that we have in the way that we've been trying to shelter in place. But many of the neglected diseases that people are living with or remaining undiagnosed are, that comes at a cost. And so I think that my encouragement to people would just be to seek the help that you need, and that telemedicine is a wonderful opportunity for people to access something if they don't think that it warrants the risk of walking into a hospital or a doctor's office. So I hope that telemedicine stays.
Love it. Thank you so much for that. Yeah, I think I'll just sort of do a little shameless plug and say, particularly with mental health care, because I think one of the things that has been really incredible actually about this time is that there's this spotlight put on mental health in a way that I've never quite seen before. Just more openness around it. A lot of people are reaching out for services in ways that they never have before. And so I just want to highlight that for mental health particularly. But what about you, Bart? What would you want people to take away from this the most?
I think I would want people to really recognize just how toxic anxiety can be, and how important human connection is in helping cure or helping people recover from anxious and traumatic states. So the anxiety plus the isolation has been really, really bad. And I like what Blythe has been saying about it's safer outside.
Yeah.
So I really would hope people would really consider that it's actually safe to be outside, and that's the place you can connect with people. And that is going to really help improve our mental health as a community. If we can, as we're saying, think creatively about how to move outside and how to do things like school or connecting with friends or even hugging. I like the hugging part. People need hugs when they're feeling stressed and anxious. So, that's what I would hope we would learn and go forward with if we can.
Thank you for that. And I will say one last thing before I open it up to the Q&A, perhaps just to kind of tie it all together. I think something that I would really want for people to take away from this conversation is that in terms of what Luis is sharing about what his work has been like in the mission, and in terms of what I was sharing in terms of the rates and the data, it's really important to highlight that what is driving those numbers up is indoor activity. It's people not being able to get away from one another because they live, like you said, 5 families in a 5-room house or something. So just to really highlight that, in terms of this idea that, it's sort of like COVID doesn't discriminate. And yet, here we are economically speaking, sort of seeing the way these inequities show up, that to me, it just drives home something really urgent, which is how much healthier it is to be outdoors, and just what a challenging position we're in as a society whenever somebody is in a position where they can't do that. So it feels really important to really highlight that. So let's shift gears here, and everybody bear with me, please, as I try to manage the Q&A here. Okay, so let's see here. Why is there not, this is from an anonymous attendee, why is there not a national panel discussion like this for the public and for the most in need? We are blessed to be a part of the Battery, but how do we get this kind of discussion onto the lower income population that does not have laptop and Wi-Fi at home? Thank you very much for that question, and I will see if any of my fellow panelists want to address it. But the one thing that I will just say is really good is that we are recording this conversation, and it's going to be available for the public after we're done tonight. And so if you feel passionately about the information that we've shared and you want to spread it far and wide, please do. Does anybody else want to comment on that before I move on to another question, or does that feel sufficient?
Well, I think it's part of the same issue. I guess the part of the answer is part of the question, which is because this population don't have access, to this type of technology that we need. I think that community organizations that work with culturally diverse and minority clients, they kind of like do the work in some form. Basically what we do, we just provide that psycho education one-on-one ourselves, but it's just really difficult to move people together. I think one of the things that are for Latinos, for example, like the Hispanic channels, like could be TV channels, could be a good outlet for them because they actually watch Spanish TV, but I'm not as familiar as, I think it's just like the news are kind of like on the same lines as the news that we see in the other channels. So, but not necessarily, this type of community forum, it's accessible to most minorities, I think.
Thank you so much for that. Rachel has a question. How do we actively influence SF government policy and/or guidelines? Can we? Does anyone have any advice about that? Bart. Do you have any thoughts about that, Blythe? Is it possible for the average person to have any influence over these policies?
Oh, absolutely. I think that all of us have a role to play, and that we all have a responsibility of trying to put out our voice and opinions. I mean, look at San Francisco and the HIV epidemic. The reason that HIV drugs are even the price that they are is completely because of the advocacy of the community demanding low-cost treatment. So, as we think about accessibility of, COVID treatment, of the testing costs, of the, access to a vaccine, I think that it should not just be about who has the ability to pay for these things, but where should these healthcare resources really be invested to give us the greatest societal benefit? Because the groups that often have the greatest ability to pay, there will be spillover benefit to them by us ending the pandemic sooner. But it means that we need to use our voices to advocate for marginalized populations that are the ones that are the most vulnerable, and that by helping prevent their infections and treating, making sure they have access to the treatment they need, that will actually end the pandemic sooner.
Thank you so much for that. And Susan in the chat is also adding the line to contact one's supervisor. So the board of supervisors, is the sort of place to appeal to, and that sounds like good advice as well. By the way, so a couple more questions here. If you have one but haven't put it into the chat yet, please do, and we'll make sure we get to you. Every era, so this is another anonymous attendee, every era seems to have its collective trauma, war, pandemic, political upheaval, etc. How might you advise a young person seeking a career in psychology and study of counseling? What might be different in this era of pandemic and post-pandemic? Luis and Bart, do you have any, I know both of you are also very much so in training and supervisory positions, so I wonder what both of you have to say about that.
Well, I'll start by saying, look, I think if you're considering going into mental health profession, I really strongly encourage it. I think, the good news is I think society has changed a lot in terms of there being more awareness. I mean, this panel is an example of that there's a more general awareness and openness, to understanding, mental health treatment. So it's a terrific time. And actually, we haven't been doing enough training, and we haven't been training enough providers in the last decade or so. So there's actually a shortage right now of providers. I think all of you know this. Anybody who's a provider knows that, the public knows this. It's very hard to find people right
especially
now.
Nationally speaking.
And especially in rural areas.
Yeah.
I do think probably the shift, the opening up of this format, the Zoom kind of online format, actually could help a lot, because that will help people, particularly in rural areas, be able to access I think, providers more, because providers tend to live in cities. You know, I'm assuming when the pandemic's over, most people are probably going to want to go back to their therapist's office. But, you know, for people that live in very rural areas, I think it's going to be really helpful in being able to increase access.
Mm-hmm. Luis, anything you want to add to that?
I wanted to add a little bit, since, you know, I'm actually teaching a class at a graduate school program, you know, this semester in supervision and consultation, you know, that, you know, in mental health, you know, we kind of like practice, and then research kind of like catches up with us. You know, that is, research is catching up with us, instead of like, you know, in terms of telehealth and COVID and things like that. So I'm very pleased that, you know, there are many or a few, you know, research articles that I have come out now on the value, not 2020, you know, actually on the value of, you know, telehealth, you know, as a service that, you know, should stay, and that will just like open, you know, the door to you know, this mental health work. You know, one of the things that we have seen at Instituto actually is that, you know, people are accessing our services even more than, you know, when they have to come in person, you know, after a while, you know, when they actually get the technology and the phone, you know, they have access to it. So if you're Spanish speaking and you want to go to a graduate program to become a psychologist or a therapist, that'll be great too, you know, because Spanish speakers are even like a very, very, very small group of like mental health professionals around here and around the United States, I think too.
Thank you so much for that. There's something that I'll add as well too, because I'm kind of interpreting this question just a little bit differently. There's just something I want to add to it, which is this idea of what it's like to be a therapist during a time when you're living through something. You know, we're all living through this universal experience, and it's fascinating. I think something that the general public probably underestimates about what it's like to be a therapist is just how much your humanity plays a role in the work that you do. And there's something about that just becomes so amplified at a time like this. I think, you know, the air quality this past week to me is the perfect example of this, because I personally have really been struggling with the air quality. Then, of course, you know, my clients and patients are struggling with the air quality. And it's just interesting to be a therapist at a time when it's kind of like, yeah, this is hard. You know, like we're all going through something really hard, and none of us are immune to it. So there's that element of things too. I just wanted to lend that to the question asker. So we have one last question here, which is, okay, hi, thank you for your insights. Any thoughts on mental health as it relates to recent events of racial injustice? Big question. And I think, Luis, I'm going to give you first dibs on that. Do you have anything you want to share?
It is a big question, you know, but of course, you know, I think that we can really extrapolate, you know, in all of the things that we have talked about how the pandemic, you know, have impacted us, you know, in terms of like anxiety, you know, like one thing that we didn't talk about today too much is trauma, you know, like how, of course, communities of color, you know, have experienced trauma, and how that is actually, you know, being triggered now, right? You know, with the pandemic, and also, you know, with all these events, you know, that are happening, you know, in relationship to Black Lives Matter. You know, yeah, so there is of course, you know, more anxiety, you know, more post-traumatic stress syndrome, you know, coming up for people, and a big impact, you know, on people's, of course, you know, sense of safety, you know, but also a lot of union that is happening. I think one of the things that is happening for the Latino population is that there is a lot of more, you know, camaraderie, you know, with other groups, you know, the African Americans, you know, in San Francisco as well. So it's actually on the flip side, right? You know, on the other side, you know, there is a lot of like more consciousness that we have been needing, you know, for a long time, you know, like now people, I think, are more willing to see, and when we see, you know, we're gonna see good things, and we're all gonna see, you know, the difficult things, you know, that are welcome too.
Thank you so much for that. Anything you want to add, either Bart or Blythe?
Yes,
Please.
I do. You know, just in thinking about the racial injustices that are being magnified during the pandemic, one of the big ones is really seen at historically Black colleges and universities who do not have the huge endowments that some of these wealthier colleges have to either, you know, if they shut their doors for a year, they won't be able to reopen them. You know, they don't have the business to be able to sustain through this closure, or the endowments to pay for the frequency of testing their student population, which is just crazy to think, because many of these students at historically Black colleges and universities they're returning from neighborhoods that have higher burden of disease, so they're more likely to be infected. And just like the conversation we were having that Luis was saying earlier, many of these students are safer in a residence hall at their college than they are, you know, at home, and they have a much higher likelihood of being homeless, not, you know, if these historically Black schools close. So, you know, I think that it just again reveals what we value, and it's an incredible opportunity to, you know, spend time and effort and resources invested where we see racial injustices happening, you know, at so many levels that, you know, exemplified by, you know, these HBCUs.
Thank you, Blythe. And thank you everyone for joining us tonight. I will leave us with one last thing, which is just that if you are here this evening and listening to this, and if you're struggling, if you do not currently have mental health support, I want to encourage you to seek it out. And I have two resources that I want to leave everybody with. These are both local. So if you're watching this and you're not local to San Francisco, I want to encourage you to see if you have a friend who has a good therapist. Go to psychologytoday.com. There's a listserv of clinicians, lots of national resources. But locally here, you can go to joincoa.com. There's a function to look for a therapist. And there is also, for a lower free option, Access Institute, which is accessinst.org, Bart's Foundation. And so just thank you so much, everybody, for joining us. And thank you to my fellow panelists for helping me make this happen. I am very appreciative of it. And the battery wants to remind everybody that safe hugs are key. I agree. Safe hugs are key. Have a great evening, everyone. Take care.